Welcome to Community Health Matters. I'm your host, Amy Marsalis. Today on our show, we'll hear from experts on stroke awareness, walking and biking safety, and the challenges of aging. All of that coming up next on Community Health Matters. From the News Channel 5 network, this is Community Health Matters, sponsored by the United Health Foundation. Hi everyone, my first guest today is Dr. Frank LaFranchise, who is a neurologist with St. Thomas, and May is Stroke Awareness Month. So we really want to focus on knowing the symptoms, knowing who's at risk, and what kind of treatments are available, the importance of getting to an emergency room quickly. Every 40 seconds, doctor, someone has a stroke in this country.
It's really amazing. Close to 200,000 people a year die from stroke. Almost 800,000 suffer a stroke each year. It's quite a problem. The good news is that stroke had been the #3 cause of death in the U.S. It's now dropped to #5 because of risk factor identification and treatment and early intervention when someone has an acute stroke. But it's still a major problem, a major health issue across the country and in central Tennessee.
Who is primarily at risk for a stroke? You tend to think of the older population, over 65.
That's true. Older people have a higher risk of stroke, but it's important to remember that 1/3 of all strokes happen in those under age 55. The good news there and the reassuring thing is that even though kids and even infants can suffer a stroke, the prevalence in that group is very low. Maybe 1 in 100,000 to up to 10 in 100,000 depending on the study. But this is mostly a problem for older folks, but it's certainly not unheard of in people under age 55.
Okay, so people that are affected by stroke, what is actually happening in the body? I remember when I did medical reporting, them saying it's more like a brain attack versus a heart attack, a brain attack.
You're exactly right. The blood flow to the brain is interrupted, and that's what causes a stroke. That interruption may be permanent or it may be temporary, but it results in damage to tissue. And when brain tissue is damaged, a stroke occurs. There are two main types, depending on how that blood flow is interrupted. On the one hand, the more common type is where the blood vessel is blocked. And that can happen from a clot, from hardened arteries, or other explanations. The other type, which is less common, is where a blood vessel ruptures. And that can happen because of a weakening of the wall of the vessel from birth, and that gets worse over age, or it can happen over time because of the effects of high blood pressure, for instance. So those are the two main types. The type where the blood vessel is blocked happens about 85% of the time. And the type where the blood vessel ruptures, that occurs about 15% of the time.
If you have a rupture, is that harder to treat? It seems like that would be harder to treat than getting rid of a blockage.
Well, yes and no. It really depends on, one, how severe the stroke deficits are to begin with at onset, and how quickly a person gets to the hospital for help. There are treatments, though, for patients with the type of stroke where the blood vessel ruptures. Controlling blood pressure is critical. If the patient happens to be on a blood thinner, we need to reverse that quickly. If the person has an aneurysm, a weakening of the wall, we can fix that, both surgically and through a catheter approach from the groin to the brain without any surgery. So there are definitely treatments, and both types can be associated with very good outcomes if the person gets to the hospital quickly.
Time is of the essence. I know that with stroke and heart attack too.
Yes.
But with stroke, I know there's an acronym that they use. Tell us about that.
Yes, what you want to remember is FAST, F-A-S-T. F stands for face. What you're looking for with all of these is, what is the patient doing, and how do you identify the symptoms and signs of a stroke? With face, or F, you're looking for a drooping of the face. A is arm. You want to ask the person to put the arms out, and if one or both drifts down, that's abnormal. S is for speech. If the speech sounds different or the person can't get words out, that's abnormal. And T is for time. Time to go to the hospital and time to note when the symptoms started.
So are clot-busting drugs used oftentimes if you get someone to the hospital quickly enough? you can administer, I forget what it's called.
It's called TPA.
TPA, okay.
Yes, and TPA has really revolutionized stroke treatment. The interesting thing is that TPA was approved almost 20 years ago, and only now are we really using it to its full effect because patients are getting to us more quickly. And so TPA can improve outcome after a stroke, the more common stroke where the blood vessel is blocked. It has to be given within 3 to 4.5 hours after stroke symptom onset. So not everyone qualifies for that reason, but the earlier you get to the hospital, the more likely it is that we can identify it as a stroke and then treat it with TPA. There is another treatment as well, and that is where the endovascular specialist, a neurosurgeon or a radiologist, can take a catheter, and instead of putting that tube into the heart, he or she moves it to the blood vessels in the brain and can actually grab clot out of the blood vessel, restoring blood flow. That's also a treatment that requires very early, urgent intervention. So the key thing is identify a stroke and get to the hospital quickly.
All right, that's very critical. How can you prevent this from happening in the first place?
Well, that's a great question. There are very clearly identified stroke risk factors. Things like high blood pressure. If we control blood pressure, we can reduce stroke risk significantly. If you're a smoker, stop smoking. And you need help with that. Most people can't do it on their own, but there are proven strategies to help. Living a healthy lifestyle, which includes eating right and exercising regularly. Controlling things like diabetes, cholesterol. Those are all key factors that can all have an effect to lower your stroke risk.
What about, I know this is more abstract, but stress. Does stress play a part? It's hard to measure that.
It is hard to measure it, but what you can see is patients who are under stress, their blood pressure will tend to be higher. They're not going to eat as well. They're not going to sleep as well. They may not attend to their other medical problems as acutely as they should, which can then secondarily lead to increased risk for stroke.
All right. Managing stress is important for your mental health, physical health, everything anyway. So where can our viewers learn more about risk factors, treatment, etc.?
Well, one good place to go is sthealth.com.
sthealth.com,
Yes.
Okay.
And you can go there and go to the stroke portion of it, and you've got lots of good information that you can find there. And then the American Stroke Association and the American Heart Association both have websites that are full of information on stroke, stroke treatment, stroke prevention. So those are some good sources.
Great. All right, Dr. Frank LaFranchise, thank you so much. We packed a lot in a short amount of time.
Happy to be here.
Yeah,
Thanks
thank you
for
very
having me.
much. All right. And we'll be back with a lot more in this program right after this. My next guest today is Mary Beth Eichert, and she is with the Mayor's Office of Infrastructure, Transportation, and Sustainability. A lot on your plate, Mary Beth. It's good to have you here.
Thank you. Thank you.
All right, I know we're talking about so many things here, but essentially the importance of getting around town in a healthy and safe way, whether on foot or cycling. So what is the city doing in terms of promoting this, but getting people to be safe when they are out walking or bicycling?
Well, one thing that we're doing is we're continuing to invest in the infrastructure that would support the modes of walking and bicycling. So we're not, we're ununique in terms of other American cities where we've developed and built our cities primarily around the car, and that means that there's a deficit of places for people to walk and bike safely. So we're investing in the infrastructure. We're also partnering with groups like Walk Bike Nashville on education and outreach to communities on, for motorists on how to share the road, but then also for cyclists and pedestrians on how to get out there and walk and bike safely.
What are some of the tips for getting around safely? You think, oh, that's common sense, walking, stay on the sidewalk, bicycling, stay in your bike lane, but sometimes it's not quite that simple.
Yeah. Well, for pedestrians, especially if you're walking at night, you want to wear protective or visible gear where you're visible, not black clothing, maybe some reflective clothing. Maybe not walk around with earbuds in your ears, because if a motorist is making a right on red, you're not going to have any eyes in the back of your head to hear them coming. for a cyclist, utilizing low stress facilities or the bike lanes that we have. There is a map for that. It's called the Nashville Groove Map, and that's going to put you on streets that are a little bit more traffic calm, slower speeds, less vehicles, and of course wear a helmet if you're bicycling. And then for pedestrians especially, walk to the intersection to cross. Don't try to cross mid-block.
Don't jaywalk.
Right.
More pedestrians have been killed in recent months, or you mentioned before we started taping about or talking about in 2015 a bad statistic for Nashville.
Yeah, in 2015, pedestrian deaths reached a 20-year high, and we were recently ranked the 38th most dangerous metro area for walking out of 104 large metro areas. And again, that's in part because we've, sprawled, built things around the car and not necessarily made it safe to walk. We have a huge deficit of sidewalk infrastructure. The downtown and the inner ring neighborhoods have good sidewalks, and then further out, even in subdivisions, we built them, but there's a wide swath in between where we don't have that infrastructure. So retrofitting those environments, but then also making sure that motorists, for example, are slowing down. A pedestrian hit at 45 miles per hour has a 35% chance of survival. If they're struck at 25 miles per hour, they have a 90% chance of survival.
Okay, now you talk about also making yourself visible to drivers, being alert, also walking, against the traffic, right, versus with the traffic.
Right.
Which most people know that, but
Right.
some people still don't do that properly.
Right.
And as far as cyclists and them obeying the rules of the law, you do see some cyclists who will go through the traffic lights and not follow the same rules of the road.
Right. That is one area where cyclist education is really important. So cyclists are to follow the rules of the road, utilize bike lanes where they're available to them, try not to ride on the sidewalk. I know in some areas we have high speeds and a lot of car volume, and so cyclists will tend to do that, but then you could run into a conflict with pedestrians. And also, for motorists, just be patient. We do have a 3-foot law. You need to allow 3 foot when passing a cyclist, and sometimes the oncoming traffic doesn't allow that, and so you get stuck behind a cyclist, and you might just need to just wait, and then you'll be able to pass safely.
You mentioned adding more green space and more of a canopy in our downtown area for various reasons, including health reasons. Expand on that for me.
Yeah, well, we have about 30% tree cover, urban canopy in the downtown area, which is not huge. We'd like to try and get to 50%, which would be a huge undertaking. But when you have trees in the right-of-way, particularly where it's 80 to 90 degrees and very humid for several months out of the year, it can definitely enhance the pedestrian environment and make it more pleasurable and enjoyable for people to get out and walk, which obviously has a huge impact on our health.
Physical as well as mental.
Right, physical as well as mental, and then also air quality. Trees and water quality. Trees suck up a lot of pollution out of both the air and the stormwater.
What initiatives, you mentioned infrastructure improvements, any other initiatives as far as education so people know where the best places are for walking, biking in the city of Nashville as we continue to grow so rapidly? Yeah,
well, we have just wrapped up a sidewalk and bikeway master plan. It's called Walk and Bike. There was a huge public input process into that, and it recommends a priority sidewalk network and a priority bikeway network. The Urban Core Bikeway Network, would be a low-stress biking type of facility where people of all ages and abilities could feel comfortable. We have that plan now. We just need to move forward with implementation. Hopefully that is not just on the metropolitan government alone, but as new development comes in and we're able to work with businesses on redesigning our streetscapes to get bike lanes in or get sidewalks in, that's also an opportunity. But we know what direction we're heading now, and relatively these are low-cost improvements for municipal budgets. The entire Urban Core Bikeway network could be built out for less than the cost of one interstate interchange.
Is that right? What an interesting fact that is.
It's also a lot less expensive for people to get around by walking or biking. It's about $9,000 a year to operate, own, and maintain a vehicle, whereas you can walk for free or ride a bike for about $700 a year.
Isn't that the truth? And feel a lot better.
And feel a lot better and,
yes.
and more productive and live longer.
Yeah. Okay. Great information. Thank you so much as we approach the summer. Here we
Thank
are.
you.
Yeah. Thank you very much, Mary Beth.
Thanks, Amy.
Okay. A lot more ahead. Stay with us. Stroke Awareness Month, but also this is Older Americans Month, the month of May, and to talk about issues facing our senior population is Grace Smith, the Executive Director of the Council on Aging in Middle Tennessee. Welcome to the program.
Thanks for having me.
Yeah, well, tell me more about what your organization does and how you advocate and reach this population that can sometimes be isolated.
Sure. The Council on Aging of Middle Tennessee has been a nonprofit agency for 30 years, and we really exist to provide information, education, and advocacy for older adults and caregivers, and we also identify unmet needs and then serve as a catalyst to develop solutions to those needs. For the past 2 years, we've really been focused on senior transportation because it's been an unmet need that has been discussed among senior service providers for 10 years now. And the Council on Aging convened a coalition of organizations, public and private, that has been meeting, looking at models around the country, and we have now developed a new service that's going to be a call center and assisted ride program called Senior Ride Nashville that will be launching later this year.
What great news.
So we're really excited that's going to be a new option for older adults who can no longer drive.
Almost like a Lyft or Uber for seniors?
Similar in many ways, where you
Okay.
can call and request a ride. Different in that it's going to be operated primarily by volunteer drivers who will
How
be screened and
fantastic.
trained, and actually can go beyond what Uber and Lyft can do and provide door-through-door support.
Oh, that's fabulous.
Yes.
I'd not heard of this. We're
Yes.
maybe breaking some news here. That's terrific. Okay, what
Yeah.
are some of the other issues beyond transportation that our senior population, we know about health issues, but other kind of day-to-day consumer issues?
Sure. We get calls every day from caregivers who are looking for services, maybe in-home care or transportation for a spouse or a parent that they're caring for. We get calls from older adults who are concerned about being the victim of a scam. And they may have received a letter in the mail or a suspicious email, and they want to know, do you think this is a scam? How can I protect myself? We receive calls from older adults who are looking for affordable housing. And that has become a big issue that we are now doing more advocacy around and looking for solutions to help seniors who are on fixed income and need to stretch their dollars in order to find ways to either stay where they are in their own homes or find housing options that are more affordable.
How do you interact with your population? Is it like, how do you reach them? Because I wouldn't think that a lot of this population would necessarily be on the internet. Maybe I'm totally wrong. I think a lot of people are on Facebook, you know, interacting
Yes.
with their family members,
Yes.
grandchildren. So tell me about how you reach
That's a
these
great
people.
question. And we are finding, in looking at some of the research, that 6 out of 10 seniors are now on the internet. So
Terrific.
more and more numbers, particularly as baby boomers age, and we know that 10,000 adults are turning 65 every day now in this country. So tremendous numbers of baby boomers are reaching retirement age, and they are very internet savvy. So I think we're going to see more and more seniors online. For those who are not, we are out in the community all the time giving presentations to church groups, we're at the public libraries very often giving scam prevention presentations. Anywhere where we're invited. I had a women's group call me yesterday asking us to come do a scam prevention talk. So we are frequently all around Middle Tennessee speaking not only to seniors but also to professionals who work with older adults.
And that leads into my next question. What advice do you give caregivers assisting our older Americans in the community to help them protect their charges, if you will,
Yes.
to protect them from scams and other things affecting them?
The number one piece of advice that we give, because it is the biggest risk factor for being a victim of scams or financial exploitation, is to help your loved one avoid isolation. Keep them connected, stay involved, whether it's connection to neighbors, to their faith community, getting them out in the community, to the store, to wherever you can. Keep them connected to the community so they're not sitting isolated at home all the time, because that's when they're at greatest risk for being a victim of a scam. We find that programs like Meals on Wheels and some of the nonprofit run services that older adults may qualify for are also another good protection, because that's another set of eyes coming to the house and making sure, checking in to make sure they're okay. And for a lot of caregivers these days, particularly adult children, they may live in a different city and they're concerned about mom or dad being here. And so local family may not be available, and you need to call an agency like the Council on Aging, or call the Elder Care Locator, which is a nationwide service, and find out what organizations where your aging parents or where you live, if you're a senior, can provide assistance. One of the things that the Council on Aging has done for years is we produce a directory of services for seniors. And this is a comprehensive resource guide on every type of service or community resource you may want to know about.
The Council on Aging's directory of services, looks like there's quite a bit of information packed in there.
It is, and this is like the yellow pages for older adults and caregivers. It is unbiased information, but it's everything from senior centers to in-home care and home health, information on Medicare, Social Security, you name it, it's in here. And we keep this updated, particularly in our online directory, which is on our website.
Wonderful, wonderful information. Thank you for sharing this with us, Grace. What a pleasure to have you today.
Thank you.
All right, and we'll be back to close up our program right after this. Thank you for watching Community Health Matters. Learn more ways to improve your health at mycommunityhealthmatters.org. And remember, here in Middle Tennessee, our community health matters.